name is Dr. William Shubert, and I'm Professor of Pediatrics at the University of Cincinnati College of Medicine and Director of the Division of Pediatric Gastroenterology of this institution. I'm here tonight to tell you about Reye syndrome. This is a mysterious illness which was not described in medical literature until 1963. At that time, an Australian pathologist, Dr. Douglas Reye, described the signs and symptoms of this illness so that to date it still bears his name. Basically, the disease consists of two phases. In the first phase, a child, and this disease occurs only in children, a child begins with either chickenpox or a viral infection resembling influenza. At the time that the child would be expected to be recovering from either of these diseases, however, he suddenly begins to vomit. The vomiting is very severe and progressive. The vomiting is followed by a loss of consciousness, a deepening sleep, and eventually by signs of brain swelling, convulsions, and if untreated, by death. At the time that Dr. Reye described this disease, his report was widely received throughout the world, but with considerable skepticism by people in medicine. In the last 15 years, much interest has focused on Reye syndrome, and it is now apparent as a very important public health problem. Reye syndrome occurs only in children, and it is a condition for which the cause is unknown and for which the treatment at present is controversial. This film, which you are about to see, depicts the studies of a patient with Reye syndrome, which were made in 1974 during an epidemic which occurred in association with an epidemic of influenza. At that time, at the Children's Hospital Medical Center, approximately 26 cases with Reye syndrome were treated and all survived. The film was made in cooperation with James Hatfield and Steve Lasker of WBBN of Chicago and the CBS network.
This is the horror of Reye syndrome. 6-year-old Denise Hardin from Covington, Kentucky. Unconscious now, as she has been for the last 6 days. Despite 8 blood transfusions, her condition remains critical. If she does live, her brain will be damaged forever. 7-year-old Teresa Fulmer's brain is also swollen from Reye syndrome. So is her liver and the nerves in her eye. Her speech slurred by the baffling childhood disease.
But she's got swelling.
Right here.
Where do you live?
I whisper.
Teresa, can you count to 3 for me?
I can do this one.
Look, Teresa, at my fingers. How many fingers am I holding up here? How many? Can you tell me?
This working.
Teresa, does your head hurt?
Teresa will recover, as will 13-year-old Lonnie Wade, rushed here from Springfield, Ohio, after 6 days of flu and terrible pain. His mother, noticing that Lonnie became glassy-eyed and incoherent.
And he began to vomit real bad, and complained with a bad headache. And he didn't want to get out of bed, and he was drowsy at times. But then Saturday night, about 9 o'clock, he began thrashing all over the bed and saying he didn't feel well. We took him out to the emergency room.
Those the symptoms of a disease first recognized in 1963. But doctors still don't know why it starts or how. Researched here for the last 5 years. 55 patients in that time, just over half, have died. But the results have been improving. In the last 4 months, 15 of 16 children have survived, such as Lonnie and Teresa. Alive now because their Reye syndrome was recognized early and treatment started fast.
We have had significant changes within a few hours, very
dramatic and drastic changes within an hour or two after a patient being sitting up in bed, talking with slurred speech, an hour later essentially dead.
So early treatment is vital, but no one really knows which treatment works best. Here in Cincinnati, doctors follow their preliminary diagnosis with a liver biopsy, a tiny section of the liver removed, then studied under an electron microscope. Biopsies showing that in Reye syndrome, ammonia, which would become protein, instead enters the bloodstream, and that liver tissue gets fat.
This liver normally should be brown, solid brown color, and it's yellow to yellowish white in color. It's completely infiltrated with fat.
The damage caused by an all-out attack from an unknown poison. Here, the poison flushed out with blood transfusions every 12 hours. For some children, 8 or 9 times, until the child regains consciousness or permanent brain damage is confirmed.
Liver recovers.
For the child, pain.
We can carry them through the
Parents,
come through
the agony of uncertain waiting.
stages of recuperating.
We've got 3 that are downstairs that'll be going home over the next 2 or 3 days. And we have 1 in the intensive care unit which should be going downstairs tomorrow morning. And we have your child who we hope will be getting better over the next couple of days.
While results here are more encouraging and research more advanced than anywhere else in the country, doctors admit they need from 5 to 15 years to develop a vaccine against Reye syndrome. Perhaps in less time, they say, if more research money could be spent.
This is a fairly costly business because the machinery is expensive, and also we need research workers and technicians, and it is very expensive, and we are handicapped because we don't have enough money to be able to pursue even the ideas that have been generated here in the Children's Hospital Research Foundation.
5 years ago, researchers here asked the National Institute of Health for money to study Reye syndrome, but the Institute said the disease was not serious, so the request was turned down. Now the NIH provides about $400,000 for the job. That's enough to defray some cost, but it is too little for a major breakthrough.
It costs a lot of money to take care of these children in the hospital, and we lose some of them. If we could find a cure, we would save money. Perhaps the polio vaccine development, diphtheria vaccine development, and similar things have really been profitable in the long run, not only in terms of child health and the salvage of children, but also in real money in the long run.
Doctors here who work 16 to 20 hours a day trying to save children's lives complain that there is no willingness to devote more federal money for research into childhood diseases. They are worried because the Nixon administration has already proposed phasing out some of that research. Although $1 spent to prevent childhood disease would be cheaper than spending $10 to cure the disease later, children, say the researchers, are given low priority.
I think adults say they think of children first, but adults generally place highest priority on their own health and their own lives. I think if adults would place their money where their mouth is and put priority on prevention of disease in childhood and on funding of research in diseases of childhood, we would develop a great many more breakthroughs in pediatrics, such as the polio vaccine, which has eliminated this as a clinical problem throughout the world.
True, Reye syndrome is not contagious. True, it affects only a few children. But until more money is spent for those children, no one will really know how many victims there are. Many doctors will misdiagnose the disease, thinking it encephalitis. And doctors who do recognize it won't be able to cure it. So until more money is spent, the suffering will continue. And children, here and elsewhere, will continue to die, painfully and helplessly. This is Bob Fall reporting for 2 on 2.
child's illness is so bad because you can't do anything for them. Everybody with children, as we have, empathizes terribly.
You get that just horrible sinking feeling when you see something like that on television. The old cliche, I have to put it that way, I suppose, that we could send people all the way around the world and up to the moon and back and can't fix them up on home. Why in God's name can't the government spend the money where it might help a lot more people? We ought to point out, we ought to re-emphasize that the syndrome is very dangerous and could lead to death, but it is in no sense of epidemic proportions, and the parents shouldn't panic.
And once again, the symptoms, vomiting like that associated with the flu, then sleepiness, almost to a coma state, lethargy, possibly with irritability, and then also possibly with convulsions. Those are the symptoms. If those show up in a child, why, for heaven's sake, call a physician and seek aid at once. In a moment, we'll take a very good look at a Chicago